Health insurance can be complicated, and unlike a lot of other things, it doesn't get easier as you get older. Medicare Parts A through D, Medicare Advantage, Medicaid, what does it all mean and what do you need? Here to remove some of the mystery is Humana representative Alana Moodie. Alana, thanks for coming on today.
Thank you for having me, Josh.
So briefly run through the different parts of Medicare and how all of that is different from Medicaid.
Well, Medicare is a type of health insurance that's available for seniors or individuals that are disabled or anyone that has end-stage renal disease, which is also known as permanent kidney failure. There's different parts of Medicare. There's Type A, Part A, which covers your hospital. If you're an inpatient, covers inpatient hospital care, skilled nursing facilities, and then also hospital stays, and some home health care. You also have Part B, which is your medical costs. This covers your doctor's visits, outpatient services, specialist visits, some medical equipment coverage, and then also your preventative services. And then we have what's called Part C, which is also known as Medicare Advantage. This is where it's a type of health insurance where it's offered by private insurance companies like Humana, and it's approved by Medicare, and we offer all the original benefits as original Medicare, including your Parts A and Parts B coverage. And it may also include your prescription drug plan. And then you also have Part D, which is your prescription drug plan. It's added prescription drug coverage that's in addition to your original Medicare. And again, some plans may be included with your Medicare Advantage plans. Now, how is it different from Medicaid? Medicare is federally funded, and it's funded by Social Security through your tax contributions. These are all the payroll taxes that you've paid throughout your working years, through your FICA taxes. Unlike Medicaid, Medicare is an entitlement program that seniors usually enroll in at the age of 65. Now, Medicaid, Florida Medicaid is a needs-based program that is determined based on your individual's needs, financial needs, or their medical position. Now, Medicaid is also available for individuals, low-income individuals or families. Keep in mind, Medicaid varies from state to state, so every state will have a different requirements for Medicaid.
Okay. Now, we're here today to actually talk about Medicare Advantage, and I know you mentioned it, but talk a little bit more about what Medicare Advantage really is.
As I mentioned, Medicare Advantage is a type of health care plan that's offered by private insurance companies like Humana. We then administer your health care, and we have all the original benefits as original Medicare. There's different types of Medicare Advantage plans. The first one's a health maintenance organization, also known as HMOs. You also have a preferred provider organization, also known as PPOs. We also have private fee-for-service. And then there's also what's called dual eligible plans, special needs plans, which also can consist of chronic condition plans, for example, if you have diabetes or heart failure. A lot of these plans also include your prescription drug coverage.
So what are the benefits of electing to enroll in Medicare Advantage?
Well, Medicare Advantage can help you control your predictable cost with your health care. For example, it includes your prescription drug plan, so your drugs are covered. And then also, there's a maximum out-of-pocket limit. So, for example, you are protected for a catastrophic situation where you're paying a lot out of pocket. Some of the plans also is designed to help you with any chronic conditions you may have. And then also, it may include some fitness programs, such as Silver Sneakers, that will help you stay active and healthy. And then there's a 24-hour nurses hotline that's available 24 hours a day, 7 days a week.
Okay. I mean, that's a lot. So how does Humana factor into all of this? And I imagine a lot of people are still thinking, well, can't I just get this through the government?
Well, Humana, we provide the Medicare Advantage plans in the community. We've been in Pensacola for a little over 12 years. We are local. We have a local office on Creighton Road, 2032 Creighton Road. And then also, yes, you can get Medicare through the government. You can, as long as anyone's a senior or anyone that's eligible either through age or through disability, you can go to medicare.gov, humana.com, or contact all the information that we discussed.
Yeah. Okay. So I hear a lot about this open enrollment period and how you can only, enroll certain times of the year. What is all that about?
Well, we are right now through open enrollment. It's also known as the annual election period. It starts October 15th and goes through December 7th. This is the time where anyone has an option to review their options. Whatever they decide, their plan will go in effect January 1st, 2018. Again, this is a time they can understand the cost, which includes their premiums, deductibles, co-payments, maximum out-of-pockets, learn about their doctor and hospital networks, and then also changes to their current plans, and also the key differences between original Medicare and Medicare Advantage.
Okay. Now, just like with anything with health insurance, there's a lot of misconceptions out there. Go through some of those for us.
Yes, there are several misconceptions about Medicare. The first one would be your monthly payments are not the only thing you want to consider. You want to consider the overall value of the Medicare plan that you're selecting, which includes your health, your current health, your medical, and also your budget for the upcoming year. The other option is drug coverage. Drug coverage is not the same everywhere. So for example, every plan formulary is different. So each company and each plan may have a different formulary, and then it depends on the location you're getting their prescription and also which medications you're taking. And then also your plan is not just for medical and emergency visits. If you're living with a chronic condition, let's say diabetes, you want to look for a plan that's personalized with your care in forms of health coaching, health and support and education by registered nurse or any other healthcare professionals. Many Medicare Advantage plans offer a free fitness program, like I mentioned, Silver Sneakers. This encourages you to maintain a healthy and active lifestyle. And then I think one of the most important factors is you may not need the same health care as your significant other spouse. A lot of couples tend to want to pick the same plan. You want to really look at your individual healthcare needs. A spouse may be healthy and the other one may not be so healthy. So you want to look at your individual needs. And then also you're not alone when it comes to making this decision. You want to utilize your resources. Go to humana.com, medicare.gov, and then most of all, reach out to a licensed Medicare professional to help you make decisions.
Excellent. Now, we only have about a minute left, but briefly run through some of the other health and wellness benefits that Humana offers.
Well, Humana has a bold goal. We have a goal to improve the quality of healthcare in our communities by improving their quality of health by 20% by 2020. And Humana is also proud to support local community events. For example, we are the title sponsor with the Pensacola Senior Games in partnership with the City of Pensacola. And then we also recently hosted our first annual Hatson Hill Senior Proms with the Council on Aging.
Yes.
And then we also play a huge part in supporting our veterans community.
Fantastic. Well, this is really great information, especially this time of year.
Absolutely.
So thank you for sharing it with us, Alana.
Thank you, Josh.